Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes.
Welcome to another episode of Food, Freedom, and Fertility. You have one of your guests here today, Caitlin Johnson. Sophia's on vacation and on the road from Palm Springs back to San Diego. And so I had to bring one of my other most favorite people in the entire universe on the show today. I am with Alia Johnson. That's weird for me to say.
I know.
She was Alia Clark when she caught one of my babies. As I'm saying this, I pulled up her webpage a minute ago and was like, okay, I'm going to get it all in order. And I was about to say Alia Clark, but then I read her name on her screen.
You
So
can call me either.
she eloped. Did you elope?
I
Or
eloped.
Yeah, so fun.
Mm-hmm.
With her partner of many years. And they have the most beautiful family, all little baby girls. And she, as you just heard me say, one of my favorite people, was one of the midwives that attended both of my births in California and who I called when I was hit in a moment of difficulty with my birth in Kansas and wishing and hoping she would just teleport like whatever his name was from Star Trek to Kansas in that moment.
I wanted to be there.
I know.
Yeah.
Alia is just the best. She's like, I describe her often, and I hope this is not offensive, but like the mashed potatoes of all humans. She is the comfort food to my soul. She is the chicken soup mashed potato of midwives. And I'm bringing her on for a very fun and special reason today. She has kind of continued to evolve in her midwifery practice and not only has helped hundreds of babies come earthside, but now she's helping individuals who are struggling to conceive have opportunities to work on their fertility in the comfort of their own home. So I didn't even know this was possible. And Alia has taught me so much already just by following her Instagram. But that is why we've invited Alia here today. So welcome.
Thank you so much for having me. I feel like it's been such a long time coming. I've
Yeah.
fangirled over this podcast and you guys for so long. And here we
Yeah.
are.
You were around when it was like on its first days released into the ether, basically.
I took
So
some photos for you guys
you did,
for your
yeah.
podcast launch.
Our first pictures ever were Aaliyah took
Aw.
and also Sophia had just gotten married and she took pictures of her and her cutie husband. And one of the pictures that you took of my family that day is blown up and on my wall. So
Oh,
fun.
yeah.
Yeah. So this is like a multi-talented lady. Um, photographer, mother,
Oh my
sister,
gosh.
friend. She's the best.
I love you.
So talk to me. Tell me, like, I remember meeting you and loving you the instant I met you, and you were nursing. You came to one of our midwife appointments, nursing your sweet second born,
Oh.
and you just had this like benevolence and graciousness to you. I don't know really how to describe it, but she's just like your nervous system regulates when Aaliyah's around. And I hear similar things said about my voice often. And so
Yes.
if you're listening to this while you're driving, maybe pause the episode and
All
come
over.
back when we can put you to sleep. Because I think our powers combined might send you to needing a cup of coffee.
Yeah.
But welcome, Leah. I'm going to stop talking and let you say hi and
Thank
tell
you.
people a little bit more about yourself.
Yeah, like I said, I fangirled over this podcast for years. I'm stoked to be here. And yeah, that's when we met. I feel like it was a lifetime ago and yesterday all at the same time.
Yeah.
You are so special to me and a big inspiration for moving into the reproductive health space.
So cool.
Yeah, I became a midwife I got licensed as a midwife in California in 2018. When I was 26 years old, I was pregnant with my third baby and just cruising on the path to women empowerment, right? Like that's kind of what brought me here. I was big on just, like I said, birth empowerment and birth rights and advocacy um, and birth. Like that's kind of what brought me into midwifery originally. And having my own babies throughout being a midwife student, this year will be year 12 of being a doula and being in birth work before I became licensed. And so I've been in the scene for a while and throughout before I was a mother and then during and I think it's just unfolded into filling the gaps in reproductive health. So that's kind of where my practice is at currently is I'm taking a little bit of a pause on birth and attending many births anyways. I attend a few here and there always, especially to keep up my skills and to visit the people that I love. But right now I'm focusing and having an emphasis on the fertility space and
So fun.
specifically in home IUI. Yeah.
That's amazing.
Yeah.
It's an interesting thing to watch the progression of what you've done, because not only have you like always filled the gaps, you just also seem to be that person that can like jive in almost any circumstance. Like go into a room where people are like buttoned up and, very proper. I remember hanging out with you at a party or two like that, or like sleeping on my couch for part of the night and putting your hand up my crotch to see how dilated I am. Like
I like that setting better.
you can roll with just about anything.
I
I
know
was
something to be said about being workable, right?
Yeah. It is certainly in that type of a practice. I mean, literally, Alia was there when I learned how to use a diaphragm for birth control,
Mm-hmm.
like check in on baby Bonnie when she was almost 2 weeks late, like stripping membranes.
A lot of times.
Yeah, we were in the vaginal trenches together.
Yeah, we
And
were.
now you are in vaginal trenches for different reasons.
Yeah. But you know what? I'll never forget your vaginal trench when your baby was coming out. And I will never forget that head full of red hair when you were
Uh-huh.
crowning and you
That's
waddling
amazing.
over. She was the first redhead I think I had ever delivered
Yeah, I
or caught.
waddled. I was pushing on the toilet.
Yeah.
Trigger warning, guys. Uh, and I was like, "Oh yeah, this is how you do it." And then all of a sudden, I was crowning, and I was like, "No more, not pushing this baby out in this
Oh, there
like
she is.
toilet," And then I was like, "I gotta go. I don't want to be in the bathroom anymore." And I'm waddling to the bed, and everybody could just see like an inch of Fiona's head.
So much red hair.
And I so badly did not want to push her out on the bed. I get on the bed and I'm like, "Ooh, owie, owie, I don't want to be here." And you go,
Yeah.
"It hurts because the baby's coming. Just push on your next contraction." And I did. And that baby shot out of me in one push.
Yeah. Yeah. She
She
came really
flew.
fast.
Yeah.
Yeah.
The
Especially for a
story is
first.
Fiona talks about you all the time. And she's like, that midwife almost didn't catch me because
Oh,
like I
she
came
knows.
out so fast. I almost just went on the bed.
Yeah. It's a part of her identity. Yeah. She was right there at the mark. I know. I will never forget that. And both of your births.
Yeah.
And even actually your third
I
to an
know. Isn't
extent.
that wild? Oh,
Yeah, I know. Maybe I'll come for the next if there
I
is
know.
one.
If I do another one, I've told Aaliyah a few times, I'm just going to pay for like your entire month of whatever you're losing on business. So you can
I'll
just
just
hang
come out
coming
there
out
and
with me
stay.
because I always deliver so late. But of course, that'll probably be the one birth that comes like 2 weeks early or something.
Yeah,
We're
totally. I
not
would come.
actively trying to conceive people, but Aaliyah will be the first to know so I can book her 10 months out.
Yeah, I would.
Yeah.
Hey, Food Freedom and Fertility family, it's Sophia introducing Fertility Cloud. High treatment costs can be daunting, but here's some good news. 80% of Fertility Cloud patients have gotten pregnant for under $2,000 after just 5 months of treatment. Starting your family doesn't need to come with a huge price tag. Fertility Cloud virtual consultations mean you can talk to them from the comfort of your couch. They create personalized plans for men and women, whether it's ovarian stimulation with Clomid or Letrozole, Ovidrel trigger shots, guidance on male fertility, or even weight management support with medication. As a special for Food Freedom and Fertility listeners, get $50 off your initial medical doctor consultation. With meds delivered in just a day or two, unlimited support for your questions, and free follow-ups when needed, they're here to make your path to parenthood smoother and more affordable. Ready to start? Visit myfertilitycloud.com and enter Food Freedom, one word, at checkout.
Yeah. Okay. So in-home IUI, why would somebody be maybe considering this? Why would they want in-home IUI with a midwife versus a fertility clinic? How do you screen patients? Like, what does this even look like?
Yeah, there's a lot of variables to IUI, which stands for intrauterine insemination. So basically, I'll break down the process of IUI first, and then I'll kind of talk about indications, counterindications. Um, so when one is seeking out IUI, there can be a lot of different reasons why someone is looking for IUI. But basically, what we're doing is we're taking the sperm and we're putting it through what we call a wash process, where it condenses the sperm into a small cellular sample, and we're then extracting that into a syringe and inserting it at the fundus, which is the top of the uterus. And as we know about conception, the egg comes, through the fallopian tube, and it's fertilized in the fallopian tube. And the goal is that we're getting sperm as close as humanly possible, so it has the least amount of length to travel in order to ideally reach that egg and hit fertilization. Some people want IUI because they want to be single parents and they're purchasing donor sperm. Some people would like IUI because they're a same-sex couple. And I would say majority of my clients who want IUI are people who have really exhausted every other option, and this is kind of their last step before IVF. And a lot of people will come feeling defeated by that process, right? Seeking multiple fertility specialists or running into dead ends with just the abundance or the confusion of resources online. And it doesn't always have to result in IUI. Sometimes I'll consult with a patient and they'll be like, oh, we've been trying for 8 months. And a lot of the times we just have to hone in on, the fact that, wow, you've lived your whole life undiagnosed with PCOS and you're only ovulating 4 times a year,
Right. So how are you going to optimize that sex timing when your
Right.
chances are so narrow? Like, unless
Yeah.
you're one of those couples that has sex daily or every other day, if you have any variables like work travel, your partner's in the military, you work second shift and he works first shift, or
Right.
something where you really don't have regular intercourse, or there's like major shifts. We have a friend tuning in with us who's an intern of mine whose husband leaves for like 3 weeks and then comes back.
Right.
That extremely narrows your opportunities at intercourse yielding conception.
Yeah, absolutely. And like I said, there's many indications for IUI, but and fertility specialists do offer IUI. There are reproductive endocrinologists that offer IUI. I have a little bit of a different process, and my requirements are a little bit different if we're doing natural cycle IUI in your home with a midwife. Because normally, and like the mainstream medical model of infertility, when we're talking IUI for the indication of infertility, we are seeing people who have gone through multiple medicated cycles. We're inducing ovulation. We may have both male and female partners on letrozole or Clomid or some, sort of just hormonal replacement therapy or whatever the case may be. And so when we're doing at-home IUI, we really have to optimize that we're able to identify ovulation in the first place, which takes a good amount of work together, right? It takes a lot of like individualized care and education. Sometimes I'll run labs. Majority of the time I run labs. Sometimes we'll do a pelvic ultrasound and just kind of screen and see how we're feeling about optimization, because I'm never going to waste someone's time and money if I don't think that there's a good chance of success with at-home IUI. But on the flip side to that, so we're supporting the cycle naturally and not medicating the cycle, but we're also doing all the functional med alternative things that we have evidence for to support ovulation. If we have PCOS on board, decrease those androgens, whatever the case may be, regulate hormones. And another indication for, I'm hopping all over the place, but
That's okay.
we're
No,
just going.
Yeah.
Another indication for natural cycle in-home IUI can be the occurrence of low motility or just low sperm quality overall. If we have, if we've run a semen analysis and we're having, we have swimmers, but 70% of them aren't moving in the right direction, right? It's not my specialty to work with men. I usually will give some really generic, run-of-the-mill kind of recommendations for sperm health, refer them to reproductive urology, and get working on that before we then attempt IUI, because ideally, like I said earlier, we're getting the sperm as close that we can to the egg to optimize conception. So there's a lot of different reasons why someone might come to me for IUI or come to a midwife for IUI. Not to mention, it is just a concierge service overall. And you like not every location has this by any means, but it's such a blessing when we are able to help people with in-home IUI, because I get to come to your house and then we do IUI, and it's a simple procedure. You're informed, you're in control of your environment and the procedure itself. Your partner gets to be there with you, and then I literally tuck you into bed. It's the best. And that's part of the reason why I love in-home IUI more than I love in-office. I offer both, but it depends.
Amazing. And let me tell you, it's so fun when Alia tucks you into bed. I've literally had it happen so many times in my life, coming over for like a check on mama and baby one day after birth, coming a week later. Like, I've been tucked into bed. I've been scolded for not being in bed by this woman. I mean, I've had a few different occurrences.
Hopefully I wasn't mean.
No, you weren't mean. But after Bonnie, you were like, what are you doing on this side of the house? Why
what are you
not in
doing?
bed?
You're all, let me just change over this laundry really quick. It's like,
get your butt in bed.
Yeah.
That is kind of amazing, because the one thing that I will say about moving on to something like IUI that I hear from a lot of clients, I've never had IUI, but this process that you expected to be so romantic and magical and fun and sweet and alone, like, you don't expect to get pregnant in front of, a team of medical professionals.
Right.
And there's like a loss and a grief that comes along with having a more medicalized approach to fertility. Even if you're so thankful that these interventions exist, it still is hard. It's hard to not just envision getting it on with your special, like, just most loved person in your entire life alone, wherever that happens, right? Like, romantic vacation in your room, on the kitchen counter, like, wherever that happens for you. Yeah. And so the thought of going into, first of all, not just the actual insemination, but the sample collection,
Right.
Like like talking to men that have had to give multiple semen samples,
Yeah.
it is not comfortable or fun, albeit I will say till I'm dead, it's really not that big of a deal compared to everything that happens to a woman in fertility workups,
Preach, but still. Yep.
but it's still not comfortable to go and look at crunchy old 90s porn magazines and videos in a room at the urology office or the
It's
fertility
true.
clinic.
Mm-hmm.
And so I want to talk about that for sure, is the differences there in being able to be in the comfort of your own home. But to have exactly what Aaliyah just said, like have your midwife tuck you in bed. Like how special is that?
I
Like
know.
we're done with all the medical stuff. Let me take off these not plastic, but gloves, to take off
Yeah.
the latex gloves and get you cozy and make you a cup of tea and have a nap.
Yeah. And well, I think there are so many there's such a puzzle surrounding fertility, um, infertility, just that space in general. And I think there like we need to have some mashed potatoes in there. I
Mhm.
really
I
identify with
agree.
that after you. Um, it is such an emotional process, regardless, and you need to have someone loving you even just a little bit and leveling with you. It's okay to feel two things at the same time. Celebration and excitement and eagerness to start IUI. I get that a lot.
Mhm.
Um, while also feeling nervous and, like you said, grieving that lack of
Mhm.
natural conception, like what's
Mhm.
happening.
Mhm.
And I think a lot of cases, not a lot of people come to me thinking they want IUI or they need IUI. And I'm like, well, let's just do a preconception visit first. And let's
Mhm.
like dig through everything and let's spend an hour together talking about your medical history, your lifestyle, your partner's lifestyle. And sometimes it just takes that like individualized care to weed through the fact that, like, oh, you're a horseback rider.
Mhm.
No one would have known that, if we didn't like sit
Right.
here and talk about your life. Like maybe we should decrease that for a while and see if that changes anything with your motility. Um,
Interesting.
yeah, I know it is. And the mainstream medical model, um, unfortunately, because of the patient load and the way that it's developed and set up, there just isn't that luxury. And
Mhm.
that's why I like to sit in this space because um, it does have an out-of-pocket cost, but so does majority of fertility,
Oh,
a
yeah.
lot higher
Mhm.
than what I'm charging for in-home.
I
And
imagine it's probably similar to the home birth expense versus the hospital expense. Like
yeah, I
people
would say so.
really balk at what it costs to have a home birth, but when you look at the hospital bills for most births and hospital stays, it's usually 4 to 10 times as expensive at the
Totally.
minimum.
If you even went to a hospital that was in your network.
Right.
I've had that experience more than one time where they were
Yeah.
transported to a hospital that their insurance didn't cover. Um, but yeah, there's so many aspects to it and there has to be balance. And I think too that like I said, it just takes time and individualized care and combing through the different clinical pictures. I had a patient case recently where we thought, and this is common, I think, in the fertility space, where the women take the brunt of all the testing, all of the blame of it,
Mhm.
and the guilt of like we're not
Ab
conceiving because of my
absolutely.
body, right? You know all about
Mhm.
this. Um, and we've had that case going on, that scenario going on, and come to find out, it wasn't actually her at all. It was totally male factor,
Hmm.
and that needs to be just communicated and ruled out, and also everyone needs to have that education and understanding and be given the opportunity to fairness in this space.
Mm. Yeah.
Um, so it's a lot. It's multifaceted. And it's evolving too. I haven't come on the podcast until now because I felt like I needed just more time in the space, because we're always evolving. Every year I feel like I'm learning something new, and like that midwifery is teaching me, and even just like different guidelines that change, new evidence coming out, it's forever evolving.
Yeah, that is, I think about watching your practice over time and just seeing how many babies you've been there for catching and caring in the prenatal process, extrapolating that to like the excitement of this new area of practice for you.
Yeah.
But also like this, you've always been somebody that's felt so strongly about advocacy and access, and how fun to like be a part of that on a new frontier
Yeah.
where, especially too on the Central Coast. I met Alia when we lived, in the San Luis Obispo, Santa Barbara County area. And it's not like you're in LA or San Francisco
Yeah.
where there's a million clinics and so many options. Your fertility opportunities there, without bashing anyone, are much more slim and
Yeah.
have their own issues.
Mm-hmm.
And so, as with anything, having another option is so beautiful, and having choice in where you might take this next step, because very often people go straight from, we're trying to conceive, it's not working, we do minimal testing with our OBGYN. They say, let's try Clomid or letrozole, whether you have PCOS or not. Ovulation
Right.
induction and these two hormones that kind of change how your body perceives estrogen, or perceives how much estrogen is there, or blocks aromatase inhibitor. What we're essentially doing is saying, make so much more estrogen and mature more follicles,
Right.
so that we can have either a super ovulation where there's more than one follicle that gets ovulated, which increases chance of pregnancy, or we improve egg quality by this kind of like, I don't want to say steroid because this is a word in the context, but like putting your ovaries on steroids, kind of. It's
Yeah.
like jacking them up
Absolutely.
is
Mm-hmm.
essentially what's happening. And so you might get that opportunity. And if that doesn't work within a few cycles, you're typically being forwarded on to some type of fertility doctor, whether it's a reproductive endocrinologist, or there are a couple of other specialties in this kind of umbrella of care, one of which is a midwife that has extra training in reproductive medicine. I will say that once you kind of take that next step, it is very hard for the process to feel individualized. And I say this having worked with so many people that have either felt that and stopped the process, or gone through everything and had no baby at the other end
Mm-hmm.
to, so I'm sure there are people that go through the process that never find me because it worked. But the people that it doesn't serve or it doesn't work oftentimes feel like they just get put on this conveyor belt. It makes me think of, did you ever see the movie Babes in Toyland?
I'm just like
This is
so
such an
bad with old.
old
I'm so
It's
bad with
such an
old
old
movies.
reference. It's like
I'm so
a
lame.
show.
But
It's like one that my mom watched and loved as a child, and so she showed it to me. But it's basically, you're like just watching this conveyor of toys being made, and it's like, or just any widget factory. But you feel like you're on this conveyor belt where it's like,
right.
now we're in the IUI section, and most IUI protocols are not considered in a natural cycle. You've typically
Right.
moved on and graduated to ovulation induction, whether you ovulate on your own or not. Maybe we're bringing gonadotropins in, which is things like LH or FSH. And at times those can be helpful. Very often, by the time we're doing IUI, we're doing monitored ultrasounds and a trigger shot to say, you have a dominant follicle, it's this big. Now we're going to tell you when to take this shot so that we can control when ovulation happens. And then we're going to inseminate at this specific period of time.
Right.
Once you fail that process, and really what I mean is the process fails you, there's no other option typically. You're just being waved in front of you, IVF or leave the clinic.
Mm-hmm.
There's very little in monopoly terms, like passing go and collecting $200, you don't get another chance at the board typically.
Right.
And frankly, you have to be like with a really creative reproductive endocrinologist to even be offered protocols that are a little bit different given your individualized scenario.
Right.
So even hearing that you do natural cycle IUI, I hardly hear of that in the alternative space that people are typically ushered into.
Yeah.
So maybe we could talk about how a natural cycle IUI looks different from a typical IUI treatment at a reproductive clinic.
Yeah. You touched a good amount on how IUI looks in a reproductive clinic or an infertility clinic. And natural cycle IUI, there's some kind of conflicting data specifically on the HCG trigger shot. And if we're seeing higher rates of live birth, is ultimately the studies that are being talked about more recently, with natural cycle versus medicated cycle. I think the odds are a little higher with medicated cycle, but then again, those are variables that are really hard to study, like as you know, because
Mhm.
of the amount of variables
Mhm.
that goes into play with the fertility space. But with natural cycle IUI, it is definitely alternative. It's to some maybe even a little bit radical.
Mhm.
But the success rate or the increased rate of successful pregnancy tends to sit with natural cycle IUI anywhere from 4 to 12%, depending on the variable. So um, oftentimes it's the kind of the clientele, I guess, so to speak, the people that are coming in are people that don't want to get to the place of medication yet. So that's
Mhm.
kind of where natural cycle IUI comes in. Is it's decently low cost, and we may be just taking a slightly elevated chance, so to
Mhm.
speak. And so that looks like, as far as like protocol goes, in my practice anyway, I like to see 3 full, very in-depth cycle charts that we can identify ovulation for 3 cycles in a row before we inseminate. Sometimes I break that rule. People are so eager, or they've been tracking with the Aura Ring and natural cycles and LH strips for the past 12 months, and they have
Mhm.
data that they can give to me, or they've been using Anito or whatever the case may
Mhm.
be. Um, and so sometimes I'll break that rule if I have a really good collection of data.
Mhm.
Um,
And
but
ultimately, it's what? Their
it's their
health,
choice. Yeah.
their sperm,
Yeah.
their money. I mean, it's the
There's
beautiful
autonomy
thing is,
there.
yeah, if you have a higher risk tolerance or more, you have less luxury of time or more money in your pocket, there are reasons to say, can we adjust this a little bit? Um,
Exactly.
but being with a clinician that has integrity and isn't just like, because you want to move forward, let's just do it.
Right.
But, I want to check these boxes of having enough data and, whatever else you in your clinical purview would decide is important in your experience.
Right.
Um, but I love that piece of it where it's like, well, let's actually have a conversation. Part of why this sticks out to me so much is we're in the middle of making big decisions in my dad's cancer treatment, and there's so little like, yeah, let's consider that about you. It's like, here's a standard of care. We don't deviate unless yada yada. I can't tell you how many doctors pulled up like the national guidelines and went, here's where you are with your staging and you're this. And then we go to, okay, follow the chart. And then we go here and then we do.
Right. We just
And
follow the
I
algorithm.
literally, and I had to like go, I understand that. I've actually looked at this chart with 2 other oncologists. There is a 70-year-old, 74-year-old man sitting in front of you. I would like you to look at him before we have a conversation about what the standard of care is, right?
Right.
And that is where, unfortunately, so many people get lost in this fertility world too, is it is kind of like a conveyor belt, because we do have research and studies, and we do have financial interests at play with a lot of the way reproductive medicine is practiced.
Very much so.
And we have so much of a disconnect in things like cycle literacy and education around what our options are,
Right.
that we like, honestly, people think that if you can't get pregnant quickly, then you might as well just do IVF. And they never stop to consider that there's any option in between.
Yeah, I think that's a huge rhetoric that's just has a running theme. And it's heartbreaking to hear story after story of people slipping through the cracks of the infertility space. I wish there was more alternative reproductive specialists to kind of, I mean, don't we all in every
Mhm.
realm of alternative medicine? I was talking to your assistant about this, just hoping for that combo, right? And advocating for that combo. But but yeah, I see it a lot. And I think that every patient that comes into my practice, I always have a consultation first where we sit on the phone. It's supposed to be 15 minutes and it's always longer, of just figuring out like candidacy for natural cycle in home or in office IUI. And, like bare minimum, we need to have a person who's ovulating and we need to have good sperm. Does it have to be optimal sperm? No, it just needs to be at a space where parameters are, there's a general likelihood of conception with the semen analysis parameters, and then, we can get deeper into like tubal factor and PCOS and, different, ovarian markers and the endometrial lining. And we can dive into all those things, especially if there's indications to do so. But how you touched on cycle literacy, that is just a huge component that I like to utilize also because, and I like to tell people, I utilize a lot of different components to as diagnostic tools, so to speak. And cycle health and cycle tracking is something that I use in my practice for as a diagnostic tool alongside labs and imaging because as we know, labs are done on one day of the cycle. Ideally, they're done on the correct day of the cycle. So don't get me started.
Not often.
Oh, it's like almost
Not
never.
often.
I'm like, it's not that
Yeah.
hard,
I can't tell
to
you how many
educate.
patients come to me and they're like, my doctor told me I have low progesterone. And I'm like, let's just talk about when these labs happened around when you've been bleeding.
Right.
And it's like, oh yeah, well, you
Oh, yeah.
never would have
Cycle day,
ovulated by that point.
cycle day 6. Yeah. I
Yeah.
just ended my period and I have no progesterone. Yeah, I hear it all the time. And it really does go back to that, that whole idea of people slipping through the cracks in this space. I don't know exactly what it is. I think it's a few different things combined, but people do deserve the best. They deserve just time, individualized care. They deserve continuity of care, trauma-informed care surrounding fertility, and just like love, and yeah. So I think that there's a lot of different components, I guess, that we're looking at with at-home IUI anyways. And to go back to kind of your question about the juxtaposition of the two, it's so vastly different. And maybe one is better than the other depending on the person, but we can't just compare stats based off of the differences in medicated versus unmedicated cycle IUI because one may be indicated for one family and one may be indicated differently for the next. So
I mean, and when we're talking about chance of conception in any given cycle or any given medicated cycle, a lot of times when you're looking at it, it's not altogether that much more than when you're just timing intercourse, frankly. And so I don't say that to be like, you shouldn't do a medicated cycle or you shouldn't do IUI. The most beautiful thing about what I can see Alia offering is having this option of somebody helping you to understand exactly when to inseminate, somebody helping you bring the sperm that much closer to where the egg is going to be to time things as it needs to be timed. Hey, friends, we're taking a break from this episode so I can share with you a little more about one of our sponsors, Fullwell. Fullwell is a reproductive health company offering superior nutritional supplements that are made without compromise to support women and men throughout their reproductive journey. I have taken Fullwell's prenatals, their fish oil, and have literally tried every product they've released, and I stand behind this recommendation with my whole heart. One of my favorite things to recommend to clients is their fertility trio. This includes their egg and sperm quality supplement, their women's prenatal, and fish oil. This helps proactively support you getting ready to conceive. This trio includes things like CoQ10, ashwagandha, and NAC. It makes me think of a life vest. You don't want to go into pregnancy without these foundational supports. And if you've been struggling while trying to conceive, this is the time to upgrade your prenatal fertility game and check out Fullwell. Use code FFF20 today to get 20% off your first order. I think the statistics, when you look at the chances of getting pregnant in any cycle, whether we're talking about getting pregnant naturally in the wild, at home, natural cycle IUI, not natural cycle in a clinic IUI and IVF, it's always a wonder to me that pregnancy ever happens
Right.
because the statistics are frankly never really in your favor. It doesn't seem like. But I love to hear about this approach and the idea of like there's an in between that maybe feels more comfortable and appeals to a certain type of person. And
Right.
that's not like the right kind of person. That's not what I'm trying to say. But for me, knowing like, hey, I'm really struggling with ovulating and I need medication to ovulate, if that was my reality, I don't know that I would love the idea of at home IUI if I was like moving on to next steps. So it might take this one particular type of person that's like, this feels good. And then you meet with somebody like Aaliyah and she screens you and is like, this is indicated in your case, or these are the reasons why this might not be the right fit for you right now, which could
Right.
just mean you haven't timed sex optimally, or you aren't ovulating. Let's see if we can get you ovulating, or your semen quality is not what we see in the research that makes this a good opportunity for you. Let's stop and work on that or get some medicine on board for that. Um, I just love that there is another option that probably most people haven't even heard of. So,
Right.
if somebody is listening to this and they don't live in the Central Coast of California or wherever your heart takes you at some point, how could they find somebody that offers this type of service? Is there like a training group that you can then search a website? Do you just have to be like really savvy with Google?
Ugh, I know it's so tough, especially when it comes to searching for things and resources and people online. I was trained for IUI to administer IUI by an institute or an organization named Maya Midwifery and Fertility. And they have a directory on their website of everyone that they've trained. So that's a good place to start. Maya Midwifery and Fertility is a good place to start. I think
Like
that
MAYA,
M
like
A I
Mayans?
A, MAIA.
MAIA. Okay.
Yeah, maybe I can link it for you.
Okay.
Can put it in the show notes. But I also think too, based off of experience, if you find a midwife local to your area, they will most likely know someone close by that offers something of this service because it is niche. It is, in some opinions, radical, but I do think that it is necessary for some people.
For
So,
somebody who comes from that idea that this is radical, like why would they argue that? Why would they say this is so
so
extreme in
radical.
that sense? Yeah.
Right. Well, I think that there's we have to like always boil down anything in healthcare. I think we're boiling down the benefits versus the risks, right? Like, what are the pros and the
Mhm,
cons of this choice?
mhm, mhm,
And sometimes it's not outlined to us like that. We're just told what we're doing and where we're going, and what our
mhm,
success rates are or aren't, you know?
mhm,
But when it comes to medicated versus non-medicated cycle I think that people may think it's radical because there potentially is slightly less success rates with non-medicated IUI, right? Like, we are
mhm.
controlling ovulation with a medicated cycle. Um, we are able to we have a little bit more resources there when it comes to a fertility clinic and doing antral follicle count ultrasounds leading up to ovulation and all of those things. But I think the pros of unmedicated cycle IUI is that it's lower intervention for some people who may have a contraindication for hormones or just don't want to try hormones first. It's drastically reduced in terms of cost. Um, I think that overall, some people do like kind of reiterating the fact that some people don't want to try hormones, but um, there's a good group of people that would rather try natural methods or alternative methods first. And I think everyone's entitled to that if that fits with your, like I said, kind of your clinical picture, if you're indicated, if IUI is in natural cycle IUI is indicated for you. Um,
Or even your values, like
right, exactly. That too,
mhm,
because there is that aspect, and this is more my personal mission, but autonomy is huge here. And
mhm,
like I said, I'm never going to waste someone's time if I think that they're not of good candidacy for natural cycle IUI. But if they are, or maybe it's a toss up and they're trying to decide between the two and play with costs and stats and figure out what works for them in that moment, I think there's also that autonomy aspect that people um, almost unfortunately in a system where we're in healthcare for profit where you almost pay for,
mhm,
right?
mhm,
um and it is part of my value to keep my prices low because of that. Like, I think everyone
mhm,
deserves access to at least that first step,
mhm.
you know
I I echo that. I mean, I feel like the cost of healthcare, the cost of time and heartache, like even just how easy is it for you to call your practitioner and talk to them on the phone? Like
right,
who gets that access? You
yeah,
get that access if you're like the neighbor of the pediatrician. I
yeah,
lived next to a pediatrician for a while. That was
exactly,
awesome access. I like had a kid that split his lip and needed stitches. I could just like carry my kid next door. Super
yeah,
awesome access.
it's so
Who gets that
nice,
access with the doctor that's going to do their IUI? Nope. You call the office, talk to the secretary, leave a message for the nurse. The nurse
right,
gives you a call back. The nurse gatekeeps the practitioner. They're too busy or whatever
yeah,
the
they do,
setup is. And uh, even that when you're pregnant and you're dealing with your OBGYN, there's like a call service and you have to jump through 10 hoops to get to your provider. And
right,
this is that idea of concierge or luxury where you as the practitioner, maybe it grows some point to where there is somebody you call ahead of you. And I understand the nature of around the clock birth work and why you might need to not always be able to get to your provider immediately.
yes, yeah,
We are going to take a break from this episode and chat a little bit about one of our sponsors. Truth be told, when we were contacted by Fond to see if they could sponsor our Food Freedom Fertility podcast, it kind of was like one of those dream come true sponsorships. Let me explain why. There are very few foundational foods that cover broad nutrient needs for fertility, gut health, and baby's brain development like Fond is. And not only do they create these foundational foods, they kind of exceed in every category that I can think of what we want to put into our bodies. They're the only verified regenerative through land to market bone broth, tallow, and lard on the market. Unparalleled animal sourcing, all pasture raised or 100% grass fed and finished cattle. all the herbs and vegetables that are in the blends and the seasonings of these broths and lard are exclusively organic. Nothing is packaged in plastic. The entire packaging process is plastic free from kitchen to their shipping materials. When I think about this regenerative fat line that they've just introduced to the market, I use it in so many different ways. I've used their pork lard that's flavored with cinnamon and vanilla when I've been sauteing apples to put in my children's oatmeal. I've used their regenerative beef tallow that's flavored with chili and garlic as I've sauteed meat that's going to go into a slow cooked pho style dish. And then I've used their broth within that dish itself. I love the flavor combinations. I love that I can trust that these foods that I'm putting in my body are so clean, but truly delicious. The infused flavors are ready to sip, and all the fun flavors can be used to take any dish from good to gourmet. I've been using these for the last 4 or 5 months every single day and have seen a huge difference in my own health. And I know this is our fertility podcast, but we started taking on Fond as a sponsor at the same exact time that my dad got diagnosed with esophageal cancer. And I had so much peace in these moments where he could hardly eat anything, that he was sipping on a bone broth that had so much gelatin and collagen and amino acids that I knew we were reducing inflammation in his body and giving him just these beautiful, naturally occurring electrolytes and protein that was so easy to get down. This is one of my most favorite products I've ever used in my kitchen. And I am so proud that we get to partner with Fond. Fond has generously given us a coupon code for their website where you can receive 10% off. So that's FFF10. Or if you click on the link in our show notes, it actually brings you to a landing page where the discount is baked right in. And some of Sophia's and my favorite products are hanging out on that page for you to peruse. Please give this brand a try. Please support them. If you haven't listened to our episode, you are just gonna scream at how incredible this brand is and what they've come through, supporting a woman-founded business that has your health and our planet's best interest at heart. It's something that I can't be more proud that we get to partner with, and they sponsor you getting this free fertility information straight to your phone every single week. Now back to our episode.
Exactly.
But I do think that there is something to be said to being able to get to the provider and talk to the person. Like I feel like for my clients, when they're having questions, and I play so much like social worker around fertility as
I
much as I
know,
do dietitian.
right?
It's like, oh, this is going on with my cycle. Oh, I just started bleeding. Oh, I this, I that. Access to me gives them such peace of mind. And
Yeah,
so I can see how in this type of a process, even just that access to have the conversation and be screened before you have an appointment and all these things is so beautiful.
yeah, absolutely. I think that is continuity, that's gold standard continuity, I would say, of
Mhm.
care is being able to access your provider. And like, for example, I really, really like to get a 7-day post-ovulation progesterone. Like, it's almost non-negotiable for me. I will never tell someone to go in on cycle day 21. It's just inaccurate for so many people. And that takes communication via text or email for a lot of people in order to understand that as they're tracking for their first time. Like,
Mhm.
when do I start counting? Is this LH
Mhm.
surge? This is my
Mhm.
mucus today. What do you think? Um, whatever the case may be.
Yeah.
And it takes, it does almost take that kind of concierge type service that we do charge for. Um, but that makes an impact on people because it's not just about the ovulation itself. In it's about supporting the family overall. I was just
Mhm.
telling my girls this the other day when they were like, "Why do we have baby showers?" And we were going to a baby shower, and they're like, "Well, for our friends, we already had a gender reveal." why are we doing a baby shower? I'm like, well, it's actually a completely different idea. And our culture and our society likes to surround mothers and babies because that's our next generation. Like that's
Mm.
it, you know, and it just like
That just gave
boiled,
me goosebumps.
it is, right? Like,
I just love hearing you educate that to your children, your
yeah,
girls. Like, this
yeah,
is not only what we do, but also, silent subtext. This is what you should expect to have around you, people that care
yeah,
and love and surround you with support. And unfortunately, in our culture, so much of that is like set up the nursery instead of
I know.
bring mom bone broth for a week and,
Absolutely.
the things that actually support maternal health and mental health and baby. That aside, not the point of this episode, but I just love that.
But
That's so
still,
beautiful
yeah,
because that is what we're doing. We're celebrating this. And infertility is like the silent heartache where you just want to be part of that celebration. You're
right.
waiting for that moment. You're wondering why you're on this road. And truly, like having an Alia mashed potato. If anybody else was going to inseminate me other than BJ, I would want it to be Aaliyah, and then I would want her to tuck me in.
Other than BJ. And I would too. And I love doing that. And you know what? IUI is not successful a good chunk of the time. That's reality. Um, but you know what? I celebrate with people through their IVF journey. I celebrate when they do get their babies. I'll give them alternative support on the side because that's what midwives do, or just good providers do, or even just good friends. I'm
Mhm.
celebrating with a past client who we did IUI maybe 2 years ago, and they just had their twins via IVF. And I'm celebrating with them. It's like so exciting. And so, yeah, I think that ideally, there's a midwife that offers IUI in the area that your listeners are in, but the reality is there may not be.
It's more likely than not.
Yeah, some people do travel here. There's a pretty large gap from the Bay Area in California to Los Angeles where no one offers in-home IUI.
Mhm.
Um, and so I travel long and far, and same for people coming here. But
Mhm.
I think it's worth it because it's just this little niche area that exists and I think needs to have more light shed on it and is important for people to have access to it.
So everything about, being a midwife and then adding something like this to your practice, everything about that is radical to the culture that we live in.
Yeah.
Not that it should be. For millennia, people had babies in their home, next to their home. It's like it's
Yeah,
only in the
all over the
last
place.
modern history where people had babies only at the hospital for the most part. But like nothing about pretty much every career choice you've made has been anything but standing in the face of radical and saying, here I am anyway.
Yeah, just can't do it. Not my path.
It's just wild. Hey, friends, we're taking a break from our episode to talk about one of our sponsors. And this sponsor is the PCOS app. Did you know that I made an app all about PCOS? Well, I did, and you can find so many resources in it. We have slowly moved all the resources from my PCOS Hormone Academy course over into the PCOS app, and that talks about all things PCOS topically. Like if you have acne, you can go look at the skin and acne modules and see what does Western medicine offer? Why does this impact PCOS? What can we do about it? What are natural remedies? What are nutritional remedies? We talk about hair loss and hirsutism all through that lens where we go through what is it? Why is it impacted by PCOS? Or why do we need to pay more attention to this particular thing? And what can we do about it? And we provide a vast resource to help you both advocate for yourself at the doctor's office and treat yourself at home naturally. Now, the exciting thing that I want to share with you is starting in January 2025, we're starting to migrate all of the content that I have published so far on fertility into this app. I used to sell a course for $700 all about how to get pregnant with PCOS. And that is all getting moved into the app between January and March. So you can take the course as if you enrolled in the whole thing for $10 per month. So head to your app store, whether you're on a Google Android device or an Apple device. If you type in PCOS app, you just look for that really pretty lavender flower, you'll find it. Download it and join us because you're going to get weekly recipes and all the fertility focused PCOS content that you need. It will start being uploaded under the Academy tab. So stay tuned for that. And let's get back to our episode. Okay, so talk to me about like what is in your clinical bag as you show up to someone's house for
That's
IUI?
a really good question. Well, it depends on the donor type, first off. So I have a pretty large setup that I bring. I'm not going to I'll call it medium. It's not large. But if we have a fresh donor, then we need to, I'll tell you the process too, because it's fun and funny, and like we can use some humor, because we do totally have to dance around that like awkwardness of someone having to ejaculate into a cup with no lube or bodily fluids, by the way. You don't get to have any of those when you're submitting a sample. And then me having to navigate around like when we get that sample, when I arrive. So I'll tell you, if it's male and female, and we're doing in-home IUI, for example, we'll create a general time once we have a positive ovulatory signs, and usually I'll wait in my car until we have a sample, because if we're going to be doing an in-home sperm wash, which if we have a fresh sample, we need to wash the sperm and kind of like compile it and break it down, then I need to process that within 15 to 20 minutes, usually after the sample is complete. So what I bring is, obviously I bring like my speculum setup, and it's all cordless and illuminated, so that I don't know if you remember me wearing like my Gold Star headlamp, but I don't have that anymore because I actually bought an illuminated speculum system finally. So I bring that, and then the IUI intrauterine catheter and syringe, and then all the PPE, obviously, and then I bring
personal protective
equipment. Yeah, so gloves and sterile lube and some gauze and Q-tips and things like that. And then I bring my wash setup for someone who's a fresh donor. So that includes my microscope and my centrifuge. And I just bought a small little in-home IUI centrifuge, which I love. And a centrifuge is a machine that you can spin samples at a really high RPM. And what that does is it kind of, when I say wash the sperm, it's a process where you spin the sperm with a medium, basically a chemical, and it brings a pellet of the sperm to the very bottom of the test tube, and that's what we end up drawing up. And so I do that process in home, and so I look at the sample.
That's so cool.
It makes me feel like a little lab rat. I love
Scientist.
it. Yeah, it's like so much fun. It's awesome. The IUI.
I mean, you can be like, "Hey, these are your swimmers right
And I
here.
do it
Look."
all the
Like
time.
you don't get that experience in the reproductive
No,
clinic.
at all. And it's so much fun. And I just clear off my little space and make it, obviously it's not sterile, and it's never can be sterile fully, but clean. And I just ask for like a power outlet and a flat surface. And oftentimes if we have like a really soft bed that we're inseminating on, then I'll ask, can I use a cutting board from your kitchen or a cookie sheet? And we'll just put a Chuck's pad or a towel over that. And that's what our, like gynecological table is going to be. We'll just need a flatter surface so we can find your cervix and make it comfy, cozy for you. Put some pillows up, because I'm like pretty anti-stirrup most of the time. I think they're so clinical and triggering, and like I think we can do what we need to do gynecologically without stirrups most of the time. Like, don't even get me started on birth. I won't even go there. But so anyways, so I bring my centrifuge, my microscope, and I'm looking at the sample before the wash, and then I'm looking at the sample after the wash. And ideally, after the wash, I obviously don't have the equipment or the capability to do like a full semen analysis at that point in time. So we can't
Mhm.
count motility or count or anything like that with the sperm, but we can at least see, like, do we have active, well-developed sperm that is in a good trajectory of movement? And do we have an abundance of them on the slide is what I'm looking for. And then post-wash, because like I said, it goes into this condensed pellet that I'm
Mhm.
drawing up.
Drawing
Yeah,
from.
we should
Mhm.
ideally see more in the second sample under the microscope after the post-wash process is complete, and usually we do, which is awesome.
That's
Yeah, it's
amazing.
so
That's
cool.
so
So
fun.
we look at all those things. I give everyone the opportunity to check out their sample under the microscope, and everyone always wants to look. It's fun and cool, you
Of
know.
course. That would be so weird if they're like, sorry, this is just a little too much for me.
I
I
can't see my
can't."
own sperm on a molecular level. Um,
Right.
but yeah, and then we do the insemination, which usually takes maybe 5 minutes. The hardest part is like the speculum insertion and finding the cervix, which there's a lot of trauma-informed care that comes into play there when it comes to just vaginal and pelvic exams in general. There should be a lot of autonomy
Mhm.
always. I
Mhm.
I offer everyone to insert their own speculum. Almost everyone says no. No, I think you should do it. And I'm like, okay, but you have the opportunity if you want to. And then I also
Mhm.
offer people to plunge their own catheter and partake in their potential conception if they want
That's
to.
so
Yeah.
cool. Or their
Or their
partner,
partner, yeah.
like,
Either or. You get to decide.
that's so
Yeah.
cool. Do you remember BJ? You're like, "Do you want to cut the cord?" And he's like, "Yeah." And then he was like, "No, I
Yeah.
don't."
Got a little squeamish or something. Just kind of panicked for a moment there. Yeah,
Yeah.
I do remember that.
So
I
so
know.
funny.
But yeah, Caitlin, I just love you so much. Thank you for having me on and just like shedding light to this little corner of alternative fertility. Like I said, I know it's not for every person, but I think that it's a space that totally deserves recognition. So thank you.
If you really love us and you need support in the ways that our sponsors provide support, throw them some love and book your fertility cloud appointment or buy your prenatals from Fullwell or drink some damn fawn broth, because all those things could be very supportive for you. And if you use the link that we provide in the show notes, it helps them know that you learned about them from us and helps people like them continue to pay for the expenses that the show incurs to provide you free nutrition information. And we love you. Bye-bye.